Hi, my name is Tasia Holmes, and I chose to review the Positive and Negative Syndrome Scale, PANSS for short. So this assessment is a standardized clinical interview or observation that rates the presence and severity of positive and negative symptoms, as well as general psychopathology for those with schizophrenia within the last week's time. There are 30 items on the scale. 7 of the items correlate to positive symptoms, 7 items correlate to negative symptoms, and 16 measure general psychopathology symptoms. And just to review what positive and negative symptoms are in schizophrenia, the positive symptoms would be any significant change in behavior and thoughts, such as hallucinations or delusions. Negative symptoms are when you see someone withdrawing from the world around them, or they become emotionless or flat and have no interest in social activities. So this test can be administered upon admission to a hospital, on the onset of new medications, or after a few months, just, if there's possibly a need for a medication change. The scale was created by Stanley Kay, Louis Opler, and Abram Fisbin in 1987. The Positive and Negative Syndrome Scale was created out of a need for a more effective measure that attempted to measure similar constructs. So the reliability of prior tests was good, but what the creators of this test found was the validity of those tests, or the prior test, was what was in question. So the PANSS is useful in developing treatment plans because it identifies which symptoms the patient is experiencing. It's also useful because it helps look at which medications are effective with which symptoms. The age of the test can be administered is 18 and up, and administration of the test is to be performed by professionals with a B level rating or higher, which are those with a graduate degree in psychology or related field and have specialized training. The PANSS is always hand scored as well. The reliability of the test is good, with excellent internal consistency and test-retest reliability. The inner rater reliabilities for the test are in the 80s, and all scales are measured from the test. The scales consist of positive symptoms, negative symptoms, composite, and general psychopathology. There is good convergent evidence as measured against the Anderson method for evaluation and the general psychopathology scale. There is also a high correlation between the PANSS and the Andreasen assessment, which indicate a close correspondence. Normative data was gathered from a sample of 240 medicated schizophrenics. So this represented a good sample size at 8 participants per question. So anyway, thank you for listening, and I hope you all have a wonderful evening.